It's quite confusing to talk about the number of tests being done rather than the number of people being tested.
So the challenge with the measure of the number of people tested is that the way that it was measured, if you'd been tested several, at the start of the crisis, then you wouldn't count as somebody being tested for the first time. And at the start of the crisis, that was a useful measure, but now it's much less so because if somebody was tested in April and is retested now, it makes no difference the fact that they were tested or not in April if they tested negative. So that measure is harder to measure meaningfully.
What are you talking about, Health Secretary? What could be a more important bit of data than how many people are being tested? What could possibly be more important? And yet you pretend it's meaningless. Apparently meaningless how many people are being tested in this country. This is the same Health Secretary who, in the middle of March, presided over the ending of community testing because that was no longer appropriate. What does this mean, that the number of people being tested is meaningless? I wish I could ask him,
surely the amount of information you get, accurate information, the number of people who are actually being tested would actually be very, very helpful.
It's no longer meaningful to know how many people are being tested for coronavirus in this country.
And
that's
yet,
the Health Secretary.
And yet they are counting the number of tests which are being sent out. Of course, if those tests are then thrown away or aren't done or there's something wrong with them, surely that information is a little bit meaningless.
There couldn't be anything more significant or meaningful than knowing how many people are being tested. And for the Health Secretary to get away with that blather on the BBC is utterly shocking.